Hello, I'm Nahil Elias. I'm the Surgical Director of the Kidney Transplant Program at Massachusetts General Hospital. And I'll be talking a little bit about the surgical procedure with donating a kidney. The kidneys are located in the upper abdomen. This is a picture where it shows the abdomen and all the stomach, intestine, as well as the liver, pancreas, and spleen have been removed. And we see the kidneys all the way higher up and in the back. They're just underneath the muscle that's called the diaphragm that separates the abdomen from the lungs and chest. The kidneys get their blood supply from the aorta, which is the big blood vessel coming out of the heart and bringing blood to everything in the abdomen as well as in the legs. And then the blood returns into the inferior vena cava back into the heart again. The kidneys make urine, and the urine goes down into the ureters, the tubes that carry the urine all the way down to the bladder. The kidneys are all the way in the back, and right behind them are the back muscles and the ribs. And this is where the kidneys may naturally have, most of the time, a single artery, as we see in here, and sometimes they have multiple arteries, and that makes a difference in the procedure when we're taking them out. The procedure to take them out includes an incision to get exposure to the kidney. The traditional way was what we call an open nephrectomy, where an incision is made under the rib cage, obviously on the right or left side. And this is a picture where you see the kidney exposed through the skin and muscles, and this is how we get to it to remove it. This is a traditional approach, as I mentioned. It does require a longer length of stay in the hospital and a longer recovery. This is what the incision looks like after recovery. In comparison, the newer way, which is much more common nowadays, is the laparoscopic kidney donation. Laparoscopic surgery is minimally invasive procedures where multiple small incisions are made, and through one of the incisions, a camera or a laparoscope is introduced. We will be looking at a screen, a computer or a TV monitor type, that will show us what the camera is seeing inside the abdomen without directly looking inside the abdomen. This still requires general anesthesia. The procedure takes about 3 to 6 hours, and the patient is usually in the hospital about 1 to 2 days, shorter than it is with open nephrectomy. And in comparison between the open and the laparoscopic nephrectomy, you see on the left the incision with an open nephrectomy under the rib cage, as I mentioned, all the way to the back and sometimes a bit to the front. Whereas on the left, you see there is 3 small incisions around the umbilicus and a bit higher, and then a larger incision to remove the kidney lower down. Following the donation, the donors receive a nerve block to help manage the postoperative pain. This is an injection of a local anesthetic to the nerves that are supplying the area where the kidney is, or was in this situation, as well as the incisions that we use to remove the kidney. This will help with the pain. It usually lasts a good 24 hours, and it will minimize the amount of other pain medications that the patient requires. Following the donation, the living kidney donor will go to the post-anesthesia care unit. This is what we call the recovery room, and then to the transplant unit. On Blake 6, this is where they'll be recovering, in the same unit where the recipient, who is usually their loved one, is also recovering. When they wake up from the procedure, the donors will have a catheter in their bladder. This is what we call a Foley catheter. This will stay overnight and will be removed the next morning. It is to measure the amount of urine they're making and making sure that they're comfortable and they don't have to get out of bed and go to the bathroom. They will also have intravenous catheters, IVs in their arms, 1 or 2 depending on the patient. They will have a dressing or a bandage on their incision. They will have some pain, but will be getting medications to control the pain. Most donors are staying in the hospital nowadays about 1 or 2 days. The recipient surgery is usually about 3 to 4 hours. The recipient will recover also in the post-anesthesia care unit and in the transplant unit. Rarely, some recipients will require staying in the intensive care unit. The kidney recipient will stay in the hospital for about 3 days, and the kidney recipient will take medication for the rest of their life to prevent rejection of the donated kidney. Following donating a kidney, you should be able to walk, usually slowly, eat and drink, and perform your basic daily activities such as showering. But we recommend not swimming or taking a bath for 2 to 6 weeks. You will need a caregiver or a companion at home 24 hours a day for the minimum of 3 days after the hospital discharge. The caregiver cannot be the recipient who received the kidney or someone with significant medical conditions or disability that cannot help you. You should not lift anything heavier than 10 pounds for 2 to 4 weeks and will not be able to do certain moderately strenuous activities like walking a big dog or carrying groceries for 2 weeks after donating. After donating a kidney, you'll be on pain medication and should not be driving. And essentially after donating for 2 to 3 weeks, we recommend not driving. Most people cannot return to work for 2 to 6 weeks after donating a kidney, and that depends on the physical activity required for performing their own work or job. There are certain medications that we recommend minimizing or avoiding, like NSAIDs drugs, Motrin, Advil, Aleve, or ibuprofen. You will not be needing any special medications because you donated a kidney. But you are required to follow up with the transplant clinic, first at 1 week after being discharged from the hospital, then at 6 months, 1 year, and 2 years after donation. These visits will include a physical exam, checking your vitals, as well as lab tests and urine tests. Additionally, there are optional follow-ups that we will be glad to see a patient at 1 month or anytime they desire by telephone or in person to discuss any concerns about donating the kidney or anything about their kidney health. In general, maintaining a good health after donation is recommended, and following the recommendations of your primary care physicians are essential. Maintaining a healthy weight, eating a healthy diet, and certain diets like high protein diet may create additional work for the kidney and is not recommended. In general, there is no need for any special diet after donation. Exercising regularly is recommended, and those who smoked before donation, we recommend they don't start smoking again after donation. The health of the one remaining kidney should be monitored, and some donors may choose to follow up with a nephrologist or their primary care physicians. We recommend at least one of the two. Because you only have one kidney after donation, certain kidney lab tests such as creatinine and GFR on routine lab checks may be labeled as abnormal. This is expected and not concerning.